Many breast cancer patients are now able to avoid chemotherapy thanks to the findings of the Taylor-X trial.
Experts are calling the findings groundbreaking, and patients may have some newfound hope. In tonight's Health Beat, Kellyland's Sophie Heineman is finding out how the results are making an impact for a local breast cancer patient.
It was only about 4 months ago that Martha Brost received news that nobody wants to hear. Doctors diagnosed her with stage 2 breast cancer.
There's a certain amount of disbelief, and then you think, well, I guess it's my turn. A lot of women who have gone through this, so just take what comes.
Her doctor presented her with the option of doing the Oncotype DX test, which tests whether or not you're a good candidate for chemotherapy.
Kind of helps us predict if the patient is high risk of recurrence or low risk, if the patient benefits from anti-estrogen therapy, or there is a benefit from the chemotherapy.
Though the Oncotype DX test helped narrow treatment options, it left some gray area.
If there were 100 women in my situation, 90 of them would be fine without chemo. 4 of them would be helped by chemo, and 6 of them, the chemo wouldn't do any good anyway.
Ross decided against chemo.
I thought, I'll take my chances on being in the 90.
The Taylor-X trial began in 2006 with hopes of pinpointing who should and should not receive chemo by enrolling 10,273 women, 27 of them coming from Stanford Health.
That is a huge revelation for thousands of patients with breast cancer. We were lucky that we were able to participate.
The final analysis took place in March of 2018, and the results were groundbreaking.
We can safely skip the chemotherapy and treat them with anti-estrogen therapy. This trial applies only to the patient right now with estrogen receptor positive breast cancer, which is the vast majority.
While Martha didn't participate in the trial, the findings from the study affirmed that she made the right decision.
It's very interesting to read about it and to see that we had followed just the right procedure. Dr. Bleeker had put me on the right track, and I'm a lucky woman.
Ms. Zurchik says the results will be life-changing for many breast cancer patients, resulting in lower medical bills and a better quality of life after cancer treatment.
To me as a physician, this is just one of the biggest achievements in oncology.
With Health Beat, I'm Sophie Heineman.
Brost says her outlook is good and will move forward with her treatments in the coming weeks.
Good for her.